I'm Dr. Stacy Grossfeld. I'm an orthopedic surgeon in Louisville, Kentucky. This morning I'm going to talk a little bit about the different injections that are available if you have knee arthritis. Kind of starting with the most conventional, least expensive, going to sort of the newest, latest and greatest new frontier, most expensive. The first one is a traditional cortisone injection. Cortisone is a steroid. I like to think of it as like a liquid ibuprofen that you're putting right into the knee joint. We use a very tiny needle. It feels kind of like a flu shot when you get a cortisone shot. It will usually last anywhere between 3 to 4 months. It doesn't really do anything to the knee except stop the inflammation, kind of shuts down the inflammatory process. But within about 3 to 4 months, your symptoms will come back. Most insurance companies do cover that once you've met your deductible and your co-insurance. The second injection is a hyaluronic acid injection, also known as the rooster comb injection. I've heard it called the chicken fat injection. I've heard it called a whole lot of different things, but it's a synthetic hyaluronic acid. Hyaluronic acid is a natural fluid in your knee joint, and it's very thick. However, when you get arthritis, the hyaluronic acid produced is very thin, almost water-like. So by injecting a synthetic hyaluronic acid, it tricks the synovial sites, which are the cells that cover the lining of your knee joint that produce that normal thick fluid. So it tricks them into producing a normal thick fluid, and it lasts for about 6 months to a year, and then at some point the synovial sites realize that the knee is still arthritic, and they go back to producing more of the water-like fluid. So this is a temporary injection called hyaluronic acid. It's covered by most insurance companies, except for Anthem in the Louisville market. Starting in December 1st, 2017, they stopped covering that benefit for most of their members. The third injection is PRP, and this is where we start to enter the orthobiologics. This is where we inject things that help your body heal itself. PRP stands for platelet-rich plasma. So what we do is we draw some blood from your arm, we put it in a centrifuge, we spin the centrifuge around, it separates out the platelets, which have growth factors, from the rest of the blood cells. And then in turn, we inject a very thick, concentrated injection of platelets right into the knee joint. It's about 3 cc's, so again, feels like about a flu shot, not very painful to do. And the growth factors in the platelets are what help to reduce the inflammation and make the cartilage more healthy in the knee joint. And there's been some head-to-head studies looking at PRP versus hyaluronic acid, and they last about the same amount of time. The PRP slightly more, and the PRP gives you a more complete pain relief than the hyaluronic acid. This is not typically covered by any insurances that we're aware of in the Louisville market. It's a $325 injection that we do in my office. It takes about a 20-minute appointment. The fourth and final is what I like to call the new frontier, the Mercedes-Benz of the injections, which is stem cell recruitment therapy. We are doing this in my office now. We're using amniotic stem cells, and the amniotic stem cells are collected at the time of a normal C-section. They are screened and cleansed and sent to an FDA-approved laboratory where they are frozen, and then when we need them, we order them, we thaw them out, and then inject them into the patient's knee that has either a knee injury or knee arthritis. The stem cells have over 200 growth factors, so much more growth factors than the PRP, which we get the growth factors from the platelets. And also, when we do a PRP injection, they're coming from your platelets, and depending on your age, they may be coming from an older patient or a younger patient, where these are coming from amniotic fluid. So they're coming from a brand new baby's amniotic fluid. So I just want to make sure you understand, not from the fetus, we're not taking it from the baby, it's the fluid that surrounds the baby during a pregnancy that's actually discarded at the time of a normal cesarean section. This works the best, however, it's the most expensive. We are finding that some insurances in the Louisville market are covering this 100% after deductible and co-insurance. If not, it's a cash payment of $1,600, something we can do in the office. Thank you.